Professor. My name is Sergio Gonzalez Rodriguez. Here's my ID. And then this is my audience. This is my mom, my sister, my brother. For many medical students, taking the Hippocratic Oath is the transition that marks many of them becoming healers, primarily promising to do no harm. However, a secondary promise made during the oath is to, I will not give a deadly drug to anybody, nor I will give a suggestion to that effect. However, many physicians have bypassed this promise by overprescribing medications and fueling the opioid crisis in America. Even though this issue is very complicated, doctors have acted as a gateway for obtaining these types of medications. To help understand this, we must look at three specific procedures: aggressive overprescribing on routine procedures, establishing reliance on high dose and long-term maintenance medication, as well as the failings of patient monitoring and exit strategies. To begin with, aggressive overprescribing has been a main driver in fueling the opioid epidemic. Between the 1990s and the early 2010s, ER doctors were able to give refills on opioid pain medications for patients to be able to save in case of any other emergencies. Though this practice has effectively been curbed in the present day, it fueled millions of different pills into communities, allowing friends and families of patients to inevitably be able to use these medications for illicit reasons. A study on the transition of patients that would go on to use illegal substances also noted that they were prescribed opioid medications somewhat overly necessary, some even being prescribed opioid medications by dentists for just normal tooth cleanings. In fact, a study between two patient groups showed that when patients were educated on pain regimens, they showed better results with their pain management when given less strong pain medications compared to ones that weren't as educated on these regimens and were just given opioid pain medications, showing even though similar results could be accomplished with lesser pain medication, the standard procedures had defaulted to prescribing these types of drugs. Furthermore, the establishment of longer-term maintenance medication has increased public demand and has also fostered addiction for people for pain medication. The pain as a fifth vital sign movement, being established in the 1990s, had encouraged doctors to up patients' pain dosages in regards to increasing pain and upending their tolerance. This fostering of necessities for medications had created shady business models, such as the creation of pill mill practices by doctors, who would often trade illicit prescriptions of opioid pain medications for straight cash and illegitimate examinations. For example, Dr. Noel Blackman wrote about 2,487 prescriptions, totaling to about 365,000 oxycodone pills. He would exchange these types of prescriptions for about $300 for over the course of a year. On average, he would see about 100 patients per day, spending an absurd 6 minutes per patient. Finally, a lack of a way out for these patients had also warranted them looking to other methods of relieving their pain, such as turning to illicit substances such as fentanyl and heroin. Additionally, a lack of monitoring had been a problem for these types of doctors, with many prescription drug monitoring programs not taking commonplace until the early 2000s, and with only just 49 states only just now having state PDMPs by 2016, as well as abrupt stopping of these medications for doctors who were scared of agencies targeting their practices warranted this effect as well. An NIH study of these types of patients stated that many of them began to start illicit drugs of abrupt withdrawal of these prescription opioids. About 83% of them, when looking at 148 patients across 3 states. Many of them noted that their prescriptions were withdrawn when coming up with concerns about their necessity for these certain medications. One male patient being cut off after obtaining buprenorphine from a second doctor and was, quote, told to go back to where they had gotten that prescription. Additionally, a female patient had also brought up concerns to another doctor regarding her opioid pain medications and was abruptly taken away from the practice. In a nutshell, aggressive overprescribing, reliance on long-term medication, and lack of monitoring and exit strategies for medications have been a driving force in the opioid epidemic. Though this speech is not to discredit the validity of these types of pain medications and ethics of certain doctors, it is important to know the safe boundaries of these meds. Taking control of one's healthcare is vitally important to one's quality of life, and I encourage those out there to find a primary care physician that will work with them to find true fixes to their problems rather than just selling them these types of prescription drugs. Thank you for your time.